A dispute between the largest hospital system in Oklahoma and the largest health insurance company in the U.S. has left thousands of patients in the lurch. OU Health and United Healthcare have been at odds since an agreement between the two expired the first week of May. ONR's Steve Shaw has the details.
Andrew Hines says he's a project manager for a national retail chain. 2 months ago, this past Monday, Hines suffered a severe head injury. He was airlifted from his home in Yukon to Oklahoma City and the emergency room at OU Health. He says 3 surgeries, and 15 days later, they discharged him.
They seemed to be wanting to get me out of there pretty quickly. And I didn't really know any better, I'd never had anything like this before.
Hines says he had no idea that a very important contract between OU Health and Andrew's healthcare provider, United Healthcare, had expired on May 1st.
The original surgeries, they couldn't complete them because the swelling was so bad, so they had to wait for the swelling to go down. But upon all that happening, all of a sudden, OU decided that they weren't going to take United Healthcare anymore.
Dr. Robert Mantle is director of OU's Stevenson Cancer Center and is spokesman for OU Health. He says OU Health first went to United Healthcare 6 months before their contract expired. He says OU Health's proposal called for what he says was a modest rate increase, due in large part, he says, because of the huge cost of the global pandemic.
A lot of resignations from the healthcare workforce, salary escalation, lack of staffing really drove up the cost of healthcare delivery. And then on top of that, we've all experienced the recent inflation.
Mantle says United Healthcare's response was insulting.
And one of the disheartening things is they came, after that first proposal, they came back with that recommendation, 39% decrease in pay to the physicians and healthcare providers. That's draconian. And then on top of that, a 20% decrease in pay to the hospital system.
According to OU Health, United Healthcare turned a $17.3 billion profit last year. And they say United Healthcare's outgoing CEO made $142.2 million last year. United Healthcare is based just outside Minneapolis in Minnetonka, Minnesota. Public Relations Manager Spencer Looning wouldn't say how much money they and their outgoing CEO made last year, but he did send me this statement. OU Health sent us notice in October 2021, terminating our contract at its conclusion, along with a request with rate increases. OU Health is already the most expensive hospital in Oklahoma and the most expensive academic medical institution within a 500-mile radius. If we were to accept its current proposal, OU Health would be 34% more costly than other hospitals in Oklahoma City. Our top priority is to renew our relationship with the health system at market competitive rates so that our members have access to affordable health care. Looning also told me OU Health actually wanted a 40% rate hike over the next 3 years, which he says would have meant higher premiums for their policyholders.
We're taking care of the complicated patients, the complicated problems that no place else in the state can take care of.
And that costs money.
And it costs more. And everybody recognizes that. I believe it's a bit disingenuous of United Health to say that they don't pay academic centers more than community hospitals. That's not true.
OU Health estimates 140,000 lives could be impacted by OU hospitals not being in the United Healthcare network.
In order to recruit and retain physicians and teams with this degree of knowledge, in order to pay for somebody to be a level 1 trauma center, I not only have to have the physicians, I have to have the physicians in the hospital 24/7, ready to go. There's no other healthcare delivery system in the state of Oklahoma that's willing to take on that expense.
Hines says his closest United Healthcare option now is in Dallas.
That's a 3.5-hour drive and some time, that's for sure. Especially for my family, traveling back and forth. If they wanted to see me, they'd have to take time off work and so on and so forth.
He wants it done here.
OU has finally agreed to continuation care, but only until July 1st. But they're still not, how do you want to put this? They're not being very expedient on getting the authorizations put through to get the surgeries done. There's a lot of people that are in the same boat, and you know, it's very disheartening when you pay your premiums and you go to the hospital and one day it's fine, the next day, oh, we no longer honor your insurance. Please honor the insurance. Get this done. I want my life back.
Steve Shaw, the Oklahoma News Report.